Hi, this is Mary Shomon, and I want to welcome you to my Levothyroxine Deep Dive webinar for people with hypothyroidism who want to feel and live well. When you're hypothyroid, you're almost always going to end up taking thyroid medication for life. So why not save money on your daily thyroid treatment? In this part of the Levothyroxine Deep Dive, I talk about 7 ways to save on your levothyroxine prescriptions. All the links and details are also in your online guide at mary-shomon.com/dive. Before we jump into discussing the costs and savings, let's do a quick review of the different types of brand name and generic levothyroxine drugs. You'll find a more in-depth overview of your levothyroxine options in Part 1 of the Levothyroxine Deep Dive. Levothyroxine comes in 3 forms: tablets, capsules, and oral solution. Levoxyl is a brand name levothyroxine tablet, and it's made by Pfizer. Synthroid brand levothyroxine tablets are made by AbbVie. Tirosint capsules are manufactured by IBSA in Switzerland and marketed by IBSA USA. Tirosint Sol oral solution is also manufactured by IBSA in Switzerland and distributed and marketed by IBSA USA. Unithroid tablets are manufactured by Jerome Stevens and distributed and marketed by Amneal. There are also a number of different companies making generic versions of levothyroxine, and these are just a few of the many companies manufacturing generic levothyroxine tablets. Now let's take a look at how drugs like levothyroxine are distributed and priced. If you have health insurance, you are paying premiums for coverage provided by your health plan. Sometimes your employer may be covering the cost of at least part of those premiums. Every health plan has what's known as a formulary. That's a list of the generic and brand name prescription drugs that are covered by the plan. Health plans also contract with a pharmacy benefit manager, known as a PBM. The PBMs can be outside companies, but some plans also have their own PBM divisions or spin-off companies. The PBM is basically a middleman that performs a number of different functions. One key function of a PBM is that they help decide which drugs go on a health plan's formulary. PBMs also negotiate contracts with drug manufacturers and pharmacies to maximize profits. In exchange, the PBMs get paid by the health plans for the cost of drugs dispensed, plus administrative fees. PBMs are also frequently paid rebates by the drug manufacturers in exchange for being listed as a preferred brand on a formulary and to increase the market share for a drug. Here's a dirty little secret. PBMs are supposed to give a portion of the rebate back to the health plan to help lower your costs. Unfortunately, this rarely happens. Drug manufacturers set a list price for every drug they sell. They then typically sell their drugs to wholesalers at what's called the wholesale acquisition cost. The wholesaler turns around and sells to the pharmacies at a percentage off the wholesale acquisition cost. Pharmacies then turn around and sell the medications to you, but there are 2 different price points. There's a retail price, also called the cash price, which is what you pay if you don't have insurance or you don't use your insurance to pay for the medication. There's also a copayment price if you have insurance. That price is determined by your health plan and the pharmacy benefit manager. The following are the typical retail cash price ranges for a 1-month supply of brand name and generic levothyroxine drugs. Your copayment is the out-of-pocket cost you're expected to pay for a particular drug. A copay can be a set amount or it can be a percentage of a drug's list price, depending on your healthcare plan. Your copays are typically applied to an annual deductible. That means that you need to pay copays for your medications until you've satisfied the annual deductible for your particular healthcare plan. Your healthcare plan's approved formulary is divided into a number of categories. Usually 3, sometimes 4 is common. These categories are called copayment tiers. Your copay for any particular drug is based on which tier the drug is assigned to by your health plan's formulary and the PBM. Tiers typically correlate to the full list price or the sticker price of a drug. Let's take a look at copay tiers and average tier copays for drugs in general. Tier 1 is typically used to designate the very low-priced brands and most of the generic drugs. The Kaiser Family Foundation has done a study that found that the average Tier 1 copay for drugs is $11 or 19% of the list price. Synthroid and generic levothyroxine typically fall into Tier 1. Some plans put Levothyroxine in Tier 1 as well. Tier 2 is for preferred brands and higher priced generics. The average Tier 2 copay for drugs is $33 or 26% of the list price. Levothyroxine and Synthroid are frequently found in Tier 2 on many health plans. Tier 3 is used to designate the higher priced brands and non-preferred brands. The average copay there is $59 or 36% of the list price. Synthroid and Tirosint are frequently designated as Tier 3 by some health plans. And finally, some health plans do have a Tier 4, and that's used to designate the highest priced drugs. The average copay here is $105 or 31% of the list price. There are actually a few plans that designate Tirosint as Tier 4. There are situations where health plans choose not to cover a brand name prescription drug, and when they do, they cite various reasons, typically including the drug has a generic version that's considered equivalent, the drug is equivalent to or as effective as other brands or similar drugs but costs much more, the drug is considered less effective than other similar drugs. Many health plans will not help you pay for a drug unless it is listed on its formulary. And if you go ahead and fill a prescription for an uncovered drug, you will usually need to pay the full retail cash price. It's not common at all, but there are some reports that occasionally plans will designate Tirosint as an uncovered drug. If you're taking one of the brand name levothyroxine drugs, for example, Synthroid, Levothyroxine, Tirosint, Tirosint Sol, or Synthroid, one of the best ways to save on the cost of your medication is to take full advantage of the manufacturer's savings program. So let's take a look at those for these branded drugs. Copay cards are special discount cards that are offered by drug manufacturers that reduce the amount of your insurance copay by either a fixed amount or a percentage. Some copay cards do have a monthly or annual maximum amount you can save, and in some cases they can expire. There are also sometimes restrictions on the maximum number of times you can use the card, but the bottom line is these are frequently the best way to save on your prescriptions. Also do note, copay cards are usually not valid if you have coverage under Medicare, Medicaid, the VA, Department of Defense, TRICARE. But if you have private insurance, they are almost always available for you to use. For levothyroxine tablets, our 3 manufacturers all have copay cards. Levothyroxine has a copay card that gets you 36 to 75% off the retail cash price. Synthroid's Before Breakfast Club has a copay card that gets you a $25 copay per month for most patients with insurance. They also have an instant coupon that gets you $3 off a 1 month and $10 off a 3-month supply. And Synthroid has a copay card that gets you your prescription with around a $3 total copay per month. Thyroid patients typically associate levothyroxine with the tablet forms. And so I want to just cover a couple of pieces of information about Tirosint, which is the form of levothyroxine that comes in capsules and as an oral solution. The Tirosint forms of levothyroxine are not the same as levothyroxine tablets. They have very few ingredients called excipients and no dyes, which is why they are often recommended for patients who have sensitivities or allergies to ingredients and dyes in levothyroxine tablets or problems with absorption. You can learn more about the effect of excipients and dyes in part 1 of our Levothyroxine Deep Dive. But when compared to levothyroxine tablets, the Tirosint liquid capsules and oral solution have also been shown to have a higher resistance to elements that interfere with absorption, like food, coffee, certain supplements, and medications. So the Tirosint forms of levothyroxine are also frequently recommended for people who have gastrointestinal and digestive conditions that impair their ability to absorb levothyroxine. Because it's been recommended for these more specialized uses and because it's got a different production method, Tirosint has the highest list price and retail cash prices of all the levothyroxine drugs. The average retail cash price without any discounts or insurance is around $145 to $175 a month. Because it's typically categorized as Tier 3 or Tier 4, as we explained, the copays can run on average from around $59 to $105 a month. Some health plans and Medicare Part D programs also don't cover Tirosint on their formularies. The VA and the Department of Defense TRICARE and Medicaid, however, do cover Tirosint at fairly affordable copay prices. But because of the high copays and retail prices associated with Tirosint, the manufacturer not only has their copay card, but they also have a special wholesale program called Tirosint Direct to make the drug more affordable for anybody who can benefit from it. So if you have commercial health insurance and you have high copays for Tirosint or Tirosint Sol, IBSA's Copay Savings Card for Tirosint, which can be used at any retail pharmacy for Tirosint or Tirosint Sol, will get 9 out of 10 patients with insurance the opportunity to make a copay of as little as $25 for a 1-month supply. The Tirosint Direct program is for people who have no health insurance or prescription drug coverage or extremely high copays. As long as you have a prescription, you can order a 1 or 3-month supply of Tirosint capsules or Tirosint Sol oral solution from a designated mail order pharmacy that's part of the Tirosint Direct program. These pharmacies have staff that are trained to evaluate your price and determine your copays and figure out how you can pay the lowest amount. In many cases, if you do have insurance, they're going to get you that $25 a month rate for the Tirosint, and if you don't have insurance or you have a very high copay, you have the option to pay a cash price of $50 a month or $120 for a 3-month supply, which works out to $40 per month. Now let's take a look at patient assistance programs. A patient assistance program known as a PAP provides free or low-cost medication for people who qualify. Your eligibility for a PAP is based on your income and health insurance status. So after you apply for a PAP, you're going to provide information about your income and insurance status and are notified whether you are eligible according to each manufacturer's criteria. Most of our major drug manufacturers in the levothyroxine area have their own PAPs, and your starting place to apply and learn about their specific eligibility requirements is at their websites. And here we have the information about the 3 PAP programs for brand name levothyroxine. There are also other PAPs run by nonprofit organizations that may be able to help you offset the cost of medications if you are eligible. Here are several of the best places to search for the full range of patient assistance programs available out there. So to recap, for each of the manufacturers, here is a summary of the different options: copay cards, manufacturer coupon, direct purchase programs, and patient assistance programs that are available for each one of these drugs. Now let's take a look at the retailer discount programs. Grocery stores and pharmacies, everybody from CVS and Walgreens and Rite Aid to Kroger, Publix, and Safeway, have retailer discount programs that you can join that provide discounts on medications. For example, when you're a member of these free or low-cost programs, you can get discounts off the retail cash price of thousands of brand name and generic medications. You can start your search for these programs at Needy Meds. They have a great database of all of the discount drug programs that are available. I do want to highlight the Walmart's nationwide $4 prescription program. Some pharmacists describe this program as a loss leader, meaning that Walmart is taking a loss on some of the medications so that they can get customers in to use their pharmacy for other more profitable drugs. But you'll find a list of all the drugs on their program online, and information is on the website about where to find that list. Walmart makes dosage sizes of generic levothyroxine from 25 micrograms to 200 micrograms available for $4 for a 1-month supply and $10 for a 3-month supply. Do keep in mind, though, that with Walmart, you're not going to be able to specify which generic manufacturer you're going to get when they fill your prescription. You can learn why this is a problem for some thyroid patients in Part 1 of our Levothyroxine Deep Dive program. Some other retailers to keep in mind are Costco, and their member prescription program available for Costco members has Levoxyl and Synthroid on their preferred drug list and with discounts. There's also Blink Health, a website that lets you pre-order a prescription online and at a negotiated discount price, and then you can pick it up locally at one of 40,000 network pharmacies. And you don't need medical insurance to use this free service. I also want to talk to you about comparing prices and getting coupons to save on your drugs from sources beyond the manufacturers. There are a number of different services and websites where you can compare your drug prices, including levothyroxine, at the pharmacies in your area. You'll also find links to manufacturer and retailer copay cards, coupons, and discounts. The two best places to start your research, in my opinion, are GoodRx and SingleCare. I've also found Blink Health, which I mentioned earlier, to be helpful. There are also several other recommended sites that you can use to compare prices and research discounts. I want to give you an example of how much you can actually save in some cases using these services. I used GoodRx and SingleCare recently to compare prices on a medication, not levothyroxine, that was not covered by my insurance. The retail cash price was around $198 a month at most pharmacies. But I checked both of these sites, and SingleCare had a discount coupon for retail cash customers that brought the cost down to $98 at a local grocery store pharmacy. Are you doing the math? I saved $100 with every refill. That's $1,200 in a year. So I recommend that at minimum you search both GoodRx and SingleCare every time you fill a prescription for any drug, not just levothyroxine. Discounts can change, and some of the best coupons and savings may be available at just one of these sites. So always check all of them and find the best deal, especially if you're going to be paying retail cash price for a drug. Let's look at how you can save with mail order pharmacies. Your health plan may offer refills of prescriptions, including levothyroxine, from their own mail order pharmacy. Usually these refills are available at lower cost than at local pharmacies. So it's worth contacting your health plan to find out what the price difference would be to get mail order pharmacy refills versus refills at your local pharmacy. Also note that if you are taking Synthroid or generic levothyroxine, you can get very low prices from several wholesale mail order pharmacies. Note, however, that these pharmacies do not accept medical insurance, so you'll be paying their retail cash price, but it may be less than your copay and certainly less than what you would pay at local pharmacies. For example, there is mailmyprescriptions.com. They are licensed in 49 states. They have free shipping. They actually guarantee their lowest cash price for generic drugs, and they say they price match their competitors. And you can specify your preferred generic from two. You can get Amneal's Synthroid, or you can get generic from Alvogen at $11 to $22 for a 1-month supply. Honeybee, which is licensed in 41 states, also includes free shipping, and they make most dosage sizes of levothyroxine generic available at $8 a month or $22 for a 3-month prescription refill. RxOutreach.org is a nonprofit mail-order pharmacy, and they have 800 medications for eligible patients. If you are eligible, you can get generic levothyroxine $10 for a month, $13 for 3 months, or $20 for 6 months. That is $40 a year with 6-month refills. Very low price if you're eligible. Let's look at how you can save paying the retail cash price for your drugs. I mentioned that in many cases your copay amount may be higher than the retail cash price of your levothyroxine. And actually, there was a study released by the University of Southern California's Schaefer Center for Health Policy and Economics, and here is what they found. 42% of patients were overpaying for generic levothyroxine, an average of $6 per prescription or $72 a year. Around 44% of patients purchasing Synthroid are overpaying $10.50 a month or $126 a year. Around 50% of patients purchasing Levoxyl are overpaying by around $12 a month or $144 a year. And we also know that many patients using Tirosint are overpaying by as much as $50 to $100 per month or $600 to $1,200 per year. Let's take a look at what this means for you. For every medication, there's your copay amount, and there's a retail cash price, and those are usually going to be different amounts. Now, here's a question. When your copay is more than the cost of the drug, where do those savings go? The answer, most of the time, those savings go back to the pharmacy benefit managers. This is known as a clawback. The PBM is clawing back those savings between the drug's cost and your higher copay. Some states prohibit clawbacks, and in those states, pharmacists are required to tell you up front if a retail cash price is less than your copay. In some states, clawbacks are totally legal, and in some of those states, there are actually gag clauses that legally prevent the pharmacist from voluntarily telling you that you could pay less. Here's a quick look at how clawbacks work. At your retail pharmacy, if you don't ask what the copay is versus the retail cash price, in many cases you will automatically pay the copay price. If that price is higher, and it is 50% of the time, the savings and the difference between the copay and the cash price is going to get clawed back by the pharmacy benefit manager. Now, if you ask what the copay price is versus the retail cash price, and you pay the retail cash price because it's lower, you are going to pocket that savings. So remember, you must always ask your pharmacist directly which price is lower, my copay or the retail cash price. Because even in the states where pharmacists aren't allowed to volunteer this information, They are always required to tell you if you ask. So, for levothyroxine or any drug you're getting filled for that matter, always ask. Also remember that if you're taking a brand name levothyroxine, you want to have that manufacturer copay card or discount coupons on hand so those can be factored into your copay cost. Similarly, do your homework ahead of time and find out if there's any outside coupons or discount programs so that you can get every possible discount off that retail cash price as well. And don't forget, if you have a flexible spending account, an FSA, or a health savings account, an HSA, you can use those accounts to pay for prescription medications, which may offer additional savings off of your newly discounted prices. Let's also take a look at how you can save by getting refills of more than 1 month's supply of your medication. How much you save by ordering more than a 1-month refill of your levothyroxine depends on whether it's a generic or brand name and where you're filling your prescription. For example, generic levothyroxine at Walmart is $4 a month, or $48 a year, or $10 for a 3-month supply, which works out to around $40 a year. So choosing 3-month refills would save you a total of $8 a year. Here's another example using Levoxyl brand levothyroxine at CVS Pharmacy. A 1-month supply is $32 cash price, or $384 a year, but 3-month supply is $80, which would come out to around $320 a year. Annual savings for 3-month supplies is $64 a year. If you were using Tirosint Direct to pay the retail cash price for Tirosint, for example, you'd be paying $50 a month. But if you get a 3-month supply, it's $120 or $40 a month. Choosing 3-month refills on Tirosint would save you $120 a year. So the question comes up, should I split my levothyroxine tablets to save money? Here's the issue with splitting pills. When you split them by hand or with a pill splitter, it's a rarely precise measurement. You can end up with uneven pieces, small pieces can fall apart, you might get uneven dosing. Now, if it's a medication where precise dosing is not important, splitting tablets can actually be an effective way to cut the cost per dosage. But what about levothyroxine? Well, research has shown that the act of splitting a levothyroxine tablet can result in inconsistent dosing, and it changes the surface area of the pill, which makes the tablets degrade more quickly in terms of potency and stability. So because levothyroxine has a very narrow therapeutic index and dosage is very important, most experts do not recommend that you split your levothyroxine tablets. Let's do a quick review of how to save on the brand name and generic levothyroxine drugs, starting with Levoxyl. You should not be paying more than $7.50 up to around $25 a month for your Levoxyl, maximum. If you're taking Synthroid, you should not be paying more than around $25 a month if you have insurance, up to around $37 a month cash price. If you're taking Tirosint capsules or Tirosint Sol oral solution, you should not be paying more than $25 to $40 a month for your Tirosint prescription, whether you have insurance or not. For Synthroid brand levothyroxine tablets, you should not be paying more than $3 to $11 a month maximum for your prescription. And finally, if you're taking generic levothyroxine, you really should not be paying more than $4 to $8 a month for your prescription refills. I hope that you found this part of the Levothyroxine Deep Dive series on costs and how to save on your levothyroxine drugs helpful. Please stay tuned for the Optimizing Levothyroxine Treatment, the third part of our Levothyroxine Deep Dive, coming soon.